Now, with South Africa firmly in the grip of a second wave of the coronavirus, SABC News is revisiting hospitals where nurses went on strike over the lack of personal protective equipment last year. But the question is, do healthcare workers now have sufficient or good quality PPE? And are they satisfied with efforts that are aimed at protecting them? Thabiso Radebe, who's at the Bloemfontein National Hospital, has more.
We are just outside the National Hospital here in Bloemfontein. You will recall that this is one of the hospitals that had many cases, experienced many cases of health workers who succumbed to the pandemic, which is COVID-19. But with me to explain, because seemingly there are still those concerns, especially from the unions here. We're talking about some of the unions, including NEHAU. So fortunately here I've got with me the treasurer in Bloemfontein. As far as NEHAU is concerned, it's Matabang Ngoko, who's going to be explaining to us their concern as far as their members are concerned. Earlier on, when we were talking about the issues around here, you were saying that a protocol seemingly are not being followed by the employer.
Yeah, thank you. Indeed, the employer is not following the protocol. As we would recall that the president addressed us just before Christmas that we will be moving from level 1 to level 3. But what we see now in our hospitals is that things are still the same. It looks like we are still on level 1. Patients are flocking in, and people are not getting the proper PPE. In fact, the employer decided to select as to who gets the universal PPE according to the departments, whereas each and every health worker, according to us as NEHAU, that everybody should be having a universal PPE, but that is not happening. But our concern is that the department is basically not following the SOPs and the regulations of level 3 in a way that there's no patients that are being minimized. There is no health workers that are being given proper PPE, and we still feel that it's still not enough. The department is basically not doing enough.
Earlier on, statistically, let's talk about the members that you've lost. You said recently you lost about 6 members.
Basically, we have lost 6, but I think it could be more than that, because the numbers are actually not exact. So I'm standing to be corrected on the number, but the one that I could recall is 6 members that we have lost in this hospital that we are standing in.
You sound concerned, you look concerned. Have you tried to sort of engage the management regarding the issues that you have here, especially looking at generally the working conditions?
We have engaged with the employer, but the employer is playing mind games, because we would raise concerns as organized labor and we would come to resolutions, but the employer would not come to party. It's like the employer is just trying to play his part or her part, but yet not. Because what happens is that firstly, we agreed on the people that has comorbidities, and we then said, can they please have a plan as to how should the comorbidities be treated? Because there's a regulation that says if you have comorbidities, the employer must look at the doctor's reports and all that, and should there be any employees or members that should be working at home, they must work from home. But none of the comorbidities went home. Instead, what they then do, they try to shift them around and make them to work other duties rather than the ones that they're supposed to be executing. And secondly, we agreed also to say, let us have a rotation where all employees should not be at work, because you cannot have 100% employees, so that there must be a social distancing. But none of that is happening. If you get into our departments, it's still 100%. It's shocking, and it's alarming as well to say, how do we then deal with these issues? Patients are flocking in, members is 100%, there's no social distancing. What is this? Is this some kind of a game, or what is it? How are you coming up with documents, the regulations, but you are failing to comply?
So as far as we're talking about members here, your staff members, rather your employees here, SSS now, your members, we've moved to level 3. Is it working? Is the management, I can hear that you are not happy at all. Have they adhered to those conditions, or rather regulations, especially after moving to level 3?
Not at all. They have failed dismally. On the basis that, like I mentioned earlier on, it still looks like level 1. They have failed dismally.
There you have it in the studio. We are talking to Mathabang Ngoko, the treasurer of NEHAWU in Bloemfontein, saying that they are still concerned. The management is not coming to party, especially the health department here in the province. To sort of try and rectify the situation. You know that this hospital, which is national, is one of the hospitals that experienced many incidents, or rather many people who are dying in the past months, especially last year. So the situation is still the same. Nothing has changed. So they are very much concerned. It's back to the studio.